Before I begin, I would like to acknowledge that some of the findings of our research with participants' verbatim quotes can be difficult to hear and may cause some discomfort. But these feelings are important to engage with and reflexively when trying to address sensitive issues such as that of obstetric violence. You may also get in touch with us either right after the talk today, or if you need some time to think about it, please get in touch with us later to share your thoughts, your comments, your questions. Obstetric violence includes all forms of harm, mistreatment, disrespect, and abuse of people who are seeking perinatal care, not just in Canada, but all around the world. And it includes not just more subtle forms of disrespect, but more extreme physical, verbal, and sexual forms of violence and abuse. It is a harm that particularly unfolds in obstetric settings and by healthcare providers, and is often a result of systemic issues and a lack of humane healthcare policies, and a result of societal inequities. I also want to acknowledge that this work is led, conceptualized, analyzed, written, authored by researchers who themselves are migrants, racialized, and have lived experiences of some of these abuses and forms of violence and iniquities in reproductive health services in North America and in South Asia. Not just that, but more generally, I think positionality is a very important aspect that we have looked into and dealt with and reflected on throughout the process of analysis, of writing. Because the way we did this research, the way we analyzed it, the way we present, the methods we have used, it has a lot to do with who we are, what our experiences are, what our standpoints are, where we are in our intersections. And we very strongly believe that we could do this research in this particular manner, as I will present, because of the people we are with our identities and our experiences. Which also meant that many of the traditional forms of research, particularly quantitative research, have not been very satisfactory in finding out some of these ways that we talk about sensitive issues such as obstetric violence. In my particular journey, I started observing obstetric violence, not knowing the name of it back then, almost 15 years ago, observing it at a tertiary level hospital in India when I was getting started as a student nurse and midwife. And then for the next 10, 15 years, I very strongly looked for a language that will help me, that will allow me to bring out those narratives. But in countries like India, and now as I understand in many other parts of the world, it's not very easy to talk about bodily experiences, feminine embodied experiences, because of the body parts that are involved when you talk about any form of sexual, reproductive, or maternal health related issues or experiences. This quote by Audre Lorde, "The master's tool will never dismantle the master's house," is sort of something that has guided our research. And it's also one of those guiding sentences or quotes which helps us embed this work in critical feminist theory. Before going into that, I want to tell you a little bit about the background of the RESPECT study, which is a national survey in Canada. It started with examining 12 domains of respectful care during pregnancy and childbirth, and is an participatory action study. And it is co-led by service users from diverse identities, circumstances, and backgrounds. 6,096 respondents from all provinces and territories reported on care experiences in Canada. And 2,741 people answered the one open-ended question: if you could change one thing about your perinatal care experience, what would that be? Almost 3 years ago, that's where I joined in my postdoctoral journey to look into these almost 3,000 experiences, embodied experiences. And this analysis was then sort of divided, not pre-planned, but into two phases. Initially, it was just me and these almost 3,000 responses. And I started with generating a massive code book with 171 codes by the end of it. And almost 105 of those codes or themes were on obstetric violence. This included different kinds of physical abuse, verbal abuse, different forms of discrimination based on physical appearance, people's identities, a lot of lack of privacy, confidentiality, poor communication, and many other forms of disrespect and abuse. Now, as I was telling you, my journey in India of finding a way to bring out such narratives of obstetric violence and how it was a struggle because of a really thick stigma and shame attached to it. It wasn't just the stigma and shame, but it also is about the lack of language, because this is a form of abuse that unfolds in an obstetric setting. And it's not often easy to know what is happening around you, what are the machines that are in there, what exactly the birthing environment has. So while back then I used to think this is probably just an Indian problem, I slowly started understanding through my research that this is actually happening around the world, happening in Canada as well. So that is where I started using something called arts-based research. Back in my doctoral research, when I was doing this in India, I was doing something called body mapping. It was a more visual form of data collection and then analysis through something called voice-centered relational method. Now, while I did not do the data collection here, but it was very early on, we understood we needed to find a way to present these voices, these narratives, in ways that are more closely and as closely representing people's narratives and voices as possible. The language that people use, the words that they use, the way they share these stories. And we wanted to keep those sentences and those feelings and those voices intact. Voice-centered relational analysis or method, also quite simply called the listening guide, helps us listen to those voices. And it's a series of listenings that is required. In this case, all these 3,000 narratives, we needed to read it and reread it with a very particular motive for each reading. For example, when we read the first time, we were trying to understand what is happening in this narrative, what is the plot. In the second time we read, we are trying to understand where is the narrator placing themselves? What are they saying about themselves? There is a very interesting narrative or anecdote that I had read in a paper, which said women, when they talk about themselves, or when you ask them a question, even about their embodied experiences, and this is something I experienced while doing my India-based data collection as well, they don't necessarily talk about themselves too much. They will talk about everything else. They will talk about their family, husbands, in-laws, even the cattle in their house. But it's when you filter out the sentences that starts with an I, one actually realizes how little the person who's talking about their own feelings and experiences talks about that. So the voice of I basically helps one filter out those sentences that starts with an I. Now, the third listening, one focuses on the mood or the feel or the way something has been spoken. Some of you may have heard of this single narrative of powerlessness or disempowerment of women from India or women from Global South, which is often also extended to migrant women and racialized women in Global North. Contrapuntal voice is a word borrowed from the language of music, which basically says we are not monotonal. We don't have one form of voice. In a few sentences, or sometimes in the same sentence, we can convey a lot of moods, a lot of feelings, and it's not just helplessness. It can be resistance, it can be pleasure, it can be joy, and much more. Now, the fourth listening is about the systems, the structures, the relations. Who are the other people in this narrative? Are there family members? Are there healthcare providers? What is this person talking about them? What is this person talking about the policies, the rules, the systems about their experience? Following this, with Isabel, Bhavya, and Tamar, we generated 32 poems and created them in 3 different forms. Now, the most traditional form of doing this is called the full I poem, which is created from the voice of I by filtering out the sentences which begin with an I. But we created something called a sparse I poem and context poem. I will be talking about each of them when we talk about and see some of these poems. This slide represents what the main themes and sub-themes were from those 171 main codes and 105 mainly about obstetric violence. Obstetric violence, the challenge, is also one of our main themes, and the sub-themes are understanding these experiences in the antenatal, intrapartum, and postnatal care. We also have respectful, positive experiences to understand the way forward as another main theme bucket. And within that, our 3 main sub-themes are to understand what sort of changes can be made from top down, to start with the systems, structures, and policy level changes, then to understand the changes that can be made in the immediate birthing environment, and then what changes can be made in a more individual and interpersonal relationships. You are seeing around 14 poems here, title of poems. And in bracket next to each title, you're seeing a number, which basically represents the number of participants' voices that each poem represents. I will get started with the first poem talking about obstetric violence. And I will keep talking a little bit about the methods because it will make a lot more sense on how this adaptation has happened. Because to our knowledge, this is the first time a voice-centered relational analysis has been applied to 3,000 narratives, a survey data. So to get started with, we saw different forms of obstetric violence in antenatal care. And this is important because most of the studies that we currently come across are often talking about the intranatal and intrapartum care experiences. In the antenatal care experiences, participants talked a lot about body shaming, fat shaming, which led to a lot of stigmatization, humiliation. Verbal abuse was one of the most common extreme forms of abuse. There is a poem that Tamar created on this code. It's called Thinness. It was created from 9 participants' voices on discrimination based on physical appearance. This is a poem that kind of talks about a sum total of all forms of obstetric violence, and it's a little spread out. You will see that not all poems always stick to one particular theme very neatly, because these experiences and these sentences are not necessarily just about one phase or one duration. So we need to understand that in that totality, in that wholeness. I Was Just a Number is a poem created from 32 participants' narratives who all felt neglected at some point during their care. Each sentence that you hear is from a different participant. I felt somewhat small in a sea of experts. I was sleep deprived, alone, and desperate for help. I was completely neglected during this time. I wish staff had paid more attention to me. I yelled for help. I was very alone during much of the prenatal visits, labor, and overnight stay at the hospital due to COVID-19 virus. I felt completely alone and forgotten due to COVID. I had to be alone with very little interaction from technicians. I was left alone for most of my very intense back labor, despite my husband asking for help and advocating for me. I felt no one cared about how I felt about some of the very invasive treatments. I was getting stitches with no anesthesia. I begged for anesthesia, and she told me I didn't need it. I wasn't treated like I had consent over my body. I'll never go to that hospital again. I had an inexperienced nurse for my delivery. I would never allow a student to be a part of my labor and delivery again. I feel if my midwives could have stayed, they might have got this. I would have just liked to pick up my healthcare provider and have the same person attend my birth. I felt like because I had to formula feed my baby, I was cast aside to the corner and forgotten about. I was told by the nurse, "This is your third child. You should be able to hold her on your own." I was left alone for long periods of time with little support. I felt lost, alone in the postpartum unit. I felt abandoned by my midwives in the postpartum. I wish they had better care for me. I felt ignored at that point and during my recovery period. I would not be given an appointment unless I wanted to get an IUD. I would not have left the province of BC. I wish I had the support in the hospital. I would have demanded better care at the hospital I was at. I should have advocated more as it slowed my recovery. I think that because of my age, I was afraid to go against what was recommended to me. I was just a number. Now, this is a full I poem. A full I poem presents the whole experience about a particular topic. And in this case, as you heard, it was neglect. We do not break down the sentences unless the participant digress to another topic. And this is also very important and a good way to generate those contrapuntal voices. Here is a representation of contrapuntal voices that I tried during my doctoral journey. The idea was also to understand from the music of from the language of music, to see that there are voices that sort of um, display frustration, pressure, powerlessness, disappointment, and more negative voices, voices of discord. But then it's not just that. There are voices of anger, fear, regret, determination, some of those suspended voices. But then there is a lot of positivity as well. There's some voice of knowing, agency, hope. And the idea is the more we move from the voices of discord and suspicion to concord, the more are the experiences of respectful person-centered care. Now, as we go forward and we narrate more poems, I will really request you to try to hear some of these voices with each poem. And there are different ways of listening to these poems. You're seeing some of these illustrations are also happening on the side. So you can maybe just look at the illustrations. You can close your eyes and listen to the narrator's voice. You can read the poem as we go as well, while muting yourself. Just find a way that works for you and see if you can hear some of these voices. As I said, there is a lot of research out there that talks specifically about intrapartum period and people's experiences of obstetric violence in that period. And this is full of physical assault, verbal abuse, of being yelled at, sneered at, scolded, accused, threatened, sexual abuse. There was a participant who said they left the facility feeling raped. There's a lot of narrative about poor communication, about feeling dismissed. There is a particular sentence you will hear in two poems today that says, "I have had kids. I know what it feels like." The dead baby card is a universal form of verbal abuse. It's an example of a form of violence that cuts geographies and locations and is often used to coerce people into accepting interventions that they otherwise will not. This poem, Come Back with a Dead Baby, is created from 16 participants' narratives on the code of loss. Birth plan irritated them, scolded by nursing staff after my delivery, treated with complete disrespect and not supported once my care was transferred. Were openly discussing my unknown HIV, told to push to the count of 10, screaming the countdown numbers at me. Several nurses and a doctor whose actions and words caused me harm. Held down on hospital bed. A curtain as privacy as they took off my things, opened my legs, held me down, put a vacuum in me. Ignored for hours. Told I was wrong when I went into labor. She was being too rough. She was hurting me. Said I have had kids. I know how it feels. It's fine. Begged for anesthesia. Told me no. Said I didn't need it. Attempted to milk me. Told me that I should think about my baby's welfare. Told me she didn't want to see me back there in a year. Told me if I chose to go home, she couldn't guarantee I wouldn't come back with a dead baby. Realize how unprofessional and ignorant the labor and delivery nurses are. She stripped my membranes without warning or consent. Never experienced such pain and cramp. To this day, feel violated. Afraid to complain to the hospital. Fear he will be at my next birth. Wrote a letter of complaint about him. Never received a response. Was uncomfortable. She hurt me. I'm done. No longer a willing participant in abuse. Now, this is a context poem. You may have seen that the I part and the feeling parts have been taken off. Now, we did this because we wanted to draw the readers or the listeners' attention to the problem and to the context. In the next poem, the context will be of induction. And there will be some of these words that will make more sense to understand where this problem is being expressed and what needs to be addressed to make it more actionable. We also want to talk about the postnatal period, which is another of those ignored periods when we don't talk about what people's experiences of obstetric violence, disrespect, harm, and abuse are. Separation from the baby is one of those most common forms of disrespect. Not giving information about how a baby is doing, maybe in the NICU. There's a tremendous lack of mental health support and challenges related to breastfeeding, being judged, shamed, threatened for the inability to breastfeed and adopting formula were some of the commonest of responses. Lack of privacy and confidentiality was also seen throughout. Bhavya.
Hi, everyone. A little bit about the format of and the form of this poem. If it starts at the margin, it's a new participant, and if it's indented, it's more from the same person. I wanted to have a natural birth, but I felt scared into accepting inducement. I felt I had to prove I could deliver on my own. I was told my only chance of a vaginal delivery was an induction. I felt I was bullied into induction for no reason. I was told if I didn't go for an induction at that point, that my baby would be taken from me and put on antibiotics for 5 days in the NICU. I felt I couldn't decline. I ended up getting induced, even when I was clearly upset and crying. I was induced twice and failed both times, leading to hypercontractions and fetal distress twice. My body and my baby were not ready, and I believe that contributed to the 4th-degree tear. I fully believe that the cascade of interventions I had ultimately led to me requiring an emergency C-section. Induction led to C-section, which slowed the start of milk production and caused my baby's blood sugar to drop. I'm still upset, and I felt forced and I was forced to induce my labor. I would have learned more about induction. I would not have given in to the pressure to induce labor just because my water had broken. I think my son would have had a better chance of breastfeeding if he wasn't induced. I wish that I had stood up to the nurse who would not listen to me and refused to stop the induction when I asked her to. I would demand that I be taken off the drip and given time to start labor on my own. I would have refused induction so I could at least have had a birth experience closer to what I wanted. I would have just waited until baby was ready. I believe she would have grown more in my belly.
The next set of findings are about a way forward. Now, while these narratives mostly talk about the experiences of harm, mistreatment, abuse, violence, there were also some of those voices of resistance, suspension, and some concord. There were some demands, some asks, some suggestions on how things could be made better. It starts with changes in systems, structures, and policies. They are asking for more accountabilities, a way for grievance reporting. They're talking about how care isn't accessible or affordable, and that people are having to pay out of pocket. There's a lack of access to home birth, in some cases, cesarean section, access to midwives, doulas, massive underfunding, lack of access to anesthetists. People also talked about a staff shortage and how they realized that the healthcare providers are burnt out, more so during the experiences in COVID-19. Isabel?
It would have been too far from home. I would not like to not be forced to move across the country. I would have had to seek out treatment. I wish the resources were in my home community's hospital. I only wish I had more convenient access to the NICU unit. I would have been directed to resources that allowed me to stay. I would change is to have access to care that aligned with my values. I wish I had access to birth centers. I would have loved to give birth in a birthing center or at home. I would have liked to have had the option. I wish midwifery care was more accessible for all women. I never had the opportunity to be able to reach out to my OB when I had a question at home. I did not have access to a C-section as there were no anesthetists in the region. I would have preferred to have a doula and midwife follow me throughout the pregnancy. I would have really appreciated access to a practitioner. I didn't plan to give birth at a hospital. I don't have a car. I wish it was closer. I had to travel an hour away. I could have stayed in my home province. I live rurally. I wouldn't have to travel 550 kilometers to give birth or to get an ultrasound. I nearly had to go by plane to a major center.
People also talked about different changes that can be made in the birthing environment. They wanted their care to feel more caring and the setting not to look like a baby factory. They wanted simple things like better beds, clean private bathrooms. In cases of loss, they wanted a quiet room with a cuddle cot. They wanted some of the conflict resolution that often happened between healthcare providers like doctors, midwives, nurses, doulas to not happen in front of them. They also understood that there is a discrimination that midwives and doulas experienced. They wanted more team coordination. In terms of individual and interpersonal relationships, they wanted inclusive language to be used. Trans-competent care. Many of them refused care from students, while others found students to be more patient. They wanted gentle, supportive, and compassionate care and attention to their emotional well-being. In the next poem, you will hear some of these gentle, compassionate care being asked for. This poem is called Some Love. I wish my midwives had been more gentle with me and my physical and emotional changes. I became so exhausted and in pain from back labor. She made no suggestions to help. I told her she was being too rough and that she was hurting me. She said, I have had kids. I know how it feels. It's fine. I was screaming in pain as a result and pleading for her to stop and tell us what was happening. I tore almost to my anus, so he stitched me up, leaving a stitch a bit long that caused irritation and pain. I feel as though I received less compassion from him, and I remember apologizing to him for my outbursts due to pain. I would have spoken up about the nurse who made my birth experience so traumatic. I was young and in an abusive relationship and very isolated. I wish my midwife would have shared community resources with me and checked in to see if I was okay. I got the worst, more uncaring doctor, and to top it off, it was a long, hard labor. I was only ever asked 5 questions 6 weeks after my baby was born to see if I was depressed. I wanted to die after the first week of having my child. I wish someone would have stopped and asked me if I was okay. I guess mostly, I wish I would have had more support and some love. To sum it all up, from these 3,000 almost narratives, from these 2,741 narratives, people talked about not just the poor quality of care, but they also talked about the gaps they experienced in care provision. They talked about the impact poor quality of care can have, and also way forward, some solutions on how care can be made better, more person-centered, respectful. While a lot of these people did share their stories, there were many who couldn't come up and share what they wanted to share, say what they wanted to say, demand what they wanted to demand. All they wanted was to speak up and take a stand. So in the end, I think what we have been trying to do here is to listen. And as Ernest Hemingway says, when people talk, listen completely, because most people never listen. Thank you so much.